We also have a list that we want to show you of some stroke complications, and this is why that acronym is so important. FAST, because look what can occur. Paralysis. Gabriela, you talked about it. Usually it's on the opposite side. Okay, difficulty talking or swallowing?
So yeah, I mean, paralysis is definitely one of the most common symptoms that we see, and just like you mentioned, it would happen on one side of the body. The difficulty talking, that is something that we see commonly as well. The swallowing, it's called dysphasia. So this is the part of the brain that's affected is the part of the brain that controls the swallowing muscles. This is something that people are not even aware that could happen. So,
because we just do it automatically.
Correct, yes, and this will affect how you're eating. You start coughing things up, you can't get your food down. I mean, those kind of things are things you definitely need to get checked out. Memory loss, very common as well. People who have issues remembering what they did a few minutes ago, a few hours ago.
Emotional problems, sometimes because of the area of the brain that's affected. It could be changes in their personality, or because going through a stroke is such a psychologically traumatic experience. Patients often get depressed because they have all these changes in their physical and their mental health. So it is one of the common emotional diagnoses given to stroke patients is clinical depression.
Well, it's difficult because something like what we talked about now, Haronyd, swallowing, which is automatic, we just swallow. They have to kind of be retaught to do it again, right?
Correct, and you're grieving a loss. I mean, you've lost function. You can't do the things you normally were able to do. You suddenly can't get up from bed on your own. You can't get up from a chair on your own. You can't feed yourself. So having to mentally deal with that loss, we do see, unfortunately, a lot of depression.